Hey everyone, how you doing? Dr. Joe Musolino. I'm here with my colleague, Dr. Amy Iaquinta. Dr. Amy has recently joined HealthFit, and she's going to be practicing functional medicine. Dr. Amy, good having you here.
Thank you.
We used to work together a few
We did.
years back, and we've kept in touch over the years. And since we last worked together, you have moved into an exciting field called functional medicine. What exactly is functional medicine?
Well, it's typically dealing with chronic illnesses with people or chronic conditions, but it encompasses a lot of things. But it's more of a systems-oriented approach to people who have chronic conditions. So it's different than traditional medicine, and the way I utilize it is more along a holistic approach, a more natural approach. So it might consist of things like doing lab testing or lifestyle changes or nutritional changes or pretty much those three things, and trying to get to the root cause of what's wrong with something. So in other words, if you go to a traditional medical doctor, they might treat your symptom. Maybe you come in with fatigue or can't lose weight or difficulty sleeping, something like that. They might typically give you some sort of medication or something to address that symptom rather than getting to the root cause of what that is. And even when it comes to chronic conditions like, say, you have diabetes or a thyroid problem, trying to figure out why did you get into that state, what's causing that, and addressing it more as a systems approach rather than a piece-by-piece type of approach.
Great.
So I kind of explained
Great.
it overall what it would be.
So you mentioned some of the conditions, weight loss, sleep, having difficulty sleeping. I know we've talked a lot about stress, how you help with stress. So besides those, is there other health conditions? Like why would someone decide functional medicine is a better approach than general medicine?
There's a huge range of people that come to me for functional medicine, and so to answer that question, it's more, I will have people who have gone the traditional medical route and haven't gotten any results, first of all, or they might go the traditional medical route, get lab testing, and the doctor says they're totally fine, but they still feel crappy, so they're not getting any help with that because it might not be a full-blown disease process at this point. So there's people that come that might be looking for that. There are also people that come that want more of a natural approach. They don't want to take medications. They want to have something that's more holistic, more natural, more alternative. So I have those kind of people that come in too. Then there are people that just want overall wellness. They just want to feel better. They want to look better. They want to sleep better. They want to have more energy. So they don't necessarily have some big chronic condition. They just want to feel better. So I have people like that too. Typically the people will come in those three categories, but I have a lot of people also that might come in that just say, I just have this one thing I'm struggling with. I can't lose weight, or I have GI distress and I don't know why. So they might come in with one or two symptoms that they're trying to figure out, and they just want some direction as well. So that's another type of person that will come in. So it kind of runs the full gamut.
Sure. What would a typical visit consist of? Typically when you go to your doctor, it's pretty quick. You get blood tested, you get your vitals tested, maybe you get blood tested. If you're lucky, you get 5-10 minutes with the doctor. More often than not, they're sending you out with a prescription. That is totally not what functional medicine is. So give me just in a synopsis of what someone could expect for their actual visit when they come in for the first time.
Right. So the initial consult is going to be an hour, first of all. And prior to that consult, they're going to get some extensive paperwork. I say extensive, it's more like in-depth, a lot of questions that's really going to help me use that hour most wisely. We're going to go over what their concerns are, what their goals are, what they've tried that has maybe worked, what they've tried that hasn't worked. And part of that process of paperwork is a lot of questions about the body systems themselves. So it really gives me like a roadmap to figure out what body systems might be involved right now. So at that consult, well, actually prior to that consult, that's the best way to do it, is to get that paperwork ahead of time. I will be prepared at that consult to use that time to the best of our ability. So I'll be going over that, and then we will figure out what the next step is. So the next step for everybody could be different. The next step could be, you know what, you need more lab testing done on these certain things. So we might make a plan for that. Or it might be as simple as just tweaking some things in their nutrition, or it might be some lifestyle changes. It just depends on what we find at that consult. But by the end of that consultation, they can expect to have some sort of plan moving forward, whether it's, you know, the next step in a longer series of steps, or simply a follow-up where we've addressed the main things. These are the things you need to do. You can do that at home, and let's check back with a follow-up and see how that worked. So they will leave the consultation with some sort of answers for themselves.
Wow, that's great.
Yeah.
That's one of the things that I've always practiced is I do my initial workup, I bring them back for a report of findings. I want them leaving that first visit with the enough to give them confidence that when they come back for the report of findings that we're gonna lay everything out. It sounds like that's a similar approach that you're gonna take. How did you get into functional medicine?
Well, you know, I have a chiropractic degree, and I still have that side of a practice, but just from dealing with people for years with chiropractic conditions, I would just constantly, like you probably do in practice, I would just constantly be hearing of chronic conditions that they were having. They couldn't sleep, they had this, they had the other, and it just really piqued my interest to start trying to figure out what more can we do here. And so as I started to look into that, plus I've always been very much into fitness, lifestyle changes, nutrition, so that was kind of in my wheelhouse anyway. And so it was really just to help my patients, honestly, to help them with some of these other concerns that they were having. And as I started to dive into that, I just became so passionate about it. So that's pretty much how I did. It just evolved, it just naturally evolved into that.
That's awesome.
So.
Good.
Yeah.
We're so excited to have you. I mean, you did, and you're right. I do get this information. I hear from patients all the time that they have these other things going on. I'm primarily a musculoskeletal specialist, and I'm usually sending them out. So having you,
I just got tired of sending them out. I got tired of like not being able to help them. You know, I might tell them some things from my own background of nutrition and stuff like that, but you know, so I just took a deeper dive, I guess, into
that's
it.
awesome.
It's been great.
We won't be sending the patient out. We'll probably be sending you in.
Right. That's
So
the way it's
I'll
supposed to work.
I'll leave the room. You come right in. So lastly, we just launched Total Health,
Right.
which is our optimal health and wellness system. We just began the introductory 12-week session. You are going to play a significant role in Total Health, bringing functional medicine to the Total Health system.
Yeah.
How is
This
that?
Super exciting.
How is that going to go down?
So my role in the way that goes down is they will start with me. They will start with a functional medicine consultation, which we will go over what I just described a moment ago, kind of breaking down the body system, see if there is something more that needs to be done. Somebody else will be addressing the nutrition and the fitness, so I don't have to take the time to do that. So I'll be able to kind of target and say, hey, here's some other areas that we might need to look at. And so there will be that functional medicine piece of it. The second role I'm going to play is in the mindset stuff. So that is my big passion. And so anytime you're trying to make changes in your life, it really comes from a place of mindset. I mean, if you didn't have thoughts about doing that, then you wouldn't even be taking the steps to do that. So it always starts with the thought process to make changes. And so I am really going to help people with the mindset piece as well, to be able to achieve the goals that they're setting out to do with this whole total health thing. So they will have their initial appointment with me, and then they will have a follow-up appointment with me.
Which is the initial health assessment and then the health needs analysis.
Right, and so during the total health, they will be utilizing some tools that help us figure out more where their motivations and challenges lie. So I'll be covering that in the second appointment. And in addition to that, it depends a little bit on the person, but I will be really trying to help them target their challenges and give them tools to try to move forward in a way that's going to be the most successful for them, because everybody's different. So, and then that can go on and play a bigger role as well. It depends on the person. So, but that's, that is really key. A lot of these programs, people start and it's about nutrition or it's about fitness and they can't stick to the program, and it's very discouraging for them. And that's because I feel like that mindset piece is never really addressed. So we're really trying to do that to help people be successful with this, and not just successful in the 12-week program, but successful for the remainder of their life. Give them some tools and things that they can rely on, so that this isn't just like, hey, a 12-week program and you're done, but this is a lifestyle that you're going to be able to maintain. And that's really, the goal with this whole thing. And that's my goal. I know it's your goal, but that's kind of the piece that I'm going to play as
we're so excited.
moving forward. I know, I'm so excited.
And there is going to be the nutrition therapy. There is going to be the regular twice a week exercise. And then at the end of the 12 weeks is the introductory session. You're going to meet and assess with the individual, the client, the patient, and from there see if there is continuation of your services or other services that we offer
Right.
here, because it's health is not a 12-week thing.
Yeah.
And most of the things out there, the commercial ones, or even some of the things that other clinics and such are doing, it has a start date, it has an end date, and then the individual is left to their own devices, which is challenging. Health changes don't occur in
Right.
12 weeks, and that's why Total Health, the system is exciting. The approach that we're going to take here, and having you part of it, is going to make it so much stronger. So
Yeah, I think it's going to be great. And I think that that's what happens with people, is they do a program, then they get back to their same old habits, and it's discouraging, and it's a real bummer to have to start a whole nother thing again. So we're trying to alleviate that, because we want people to be able to make true change and have total health and true success. So I'm excited about it. I think it's going to be awesome, and I think people are going to love it.
we got some great providers that are going to be a part of Total Health. So if you want any more information, go to our website, www.healthfitmovement.com. You can also go to our YouTube page. Our videos are posted on the YouTube page, HealthFit YouTube channel, and look for more videos. We're going to be doing these regularly with Dr. Amy, with our other Total Health providers, and with the whole HealthFit team, so that we can help you to optimal health and wellness. Dr. Amy, thank you for your time.
Thanks.
Let's get going.
Let's do it.
Bye-bye.
Bye.
Join the movement. Connect with us on social media. Check out our website, healthfitmovement.com, and subscribe to our YouTube channel.